Hi, my name's Sonia Wilson and I'm a clinical psychologist working in cancer care. This video is to talk about the fear of the cancer returning. The fear of cancer returning is one of the most common concerns for patients and their families. It is often worse leading up to appointments or around scans. Although it's an understandable worry, it can also be a very upsetting experience, and there are things we can do to help. So as human beings, our brains are built for survival, and our minds adopt a better safe than sorry approach. After a cancer diagnosis, our brains are particularly wary of being under threat. We all have an internal radar that scans our body for signs or sensations of any pain or any problems. Following a cancer diagnosis, this radar is turned up high, and often sensations or symptoms that you may never have noticed before can immediately be interpreted as something more sinister or something to be concerned about. For example, after a day in the garden, you may notice that your body or your back starts to ache a little bit more. So our mind jumps to conclusions and may immediately think that the cancer has returned or the cancer has spread, and it does this without weighing up any other possibilities, such as the fact that you'd been in the garden all day working particularly hard and you are now feeling this in your body. When we feel under threat and frightened, we often want to try and get rid of this anxiety, and one way we might do this is by seeking reassurance from other people that we're okay and everything is fine. It's normal to want reassurance, however, it can often only help in the short term. People often want another scan to check that the treatment has worked and that the cancer is gone. And initially, the scan result may make you feel better in the short term, but after a few days or a few weeks, that doubt can start to creep back in. You can start to experience thoughts such as, what if the scan missed something? What if the cancer wasn't big enough to be seen? Or what if they scanned the wrong part of the body? And after a while, that wish to have another scan just to make sure can start to grow. And we can find ourselves in a vicious circle of feeling anxious, wanting to feel reassured, but then quickly feeling anxious again. We often talk about anxiety being like an insatiable tiger. The more you feed it, the more it wants. And reassurance is like catnip for anxiety. However, as human beings, it's impossible for us to get rid of our thoughts and our feelings. And actually what we know is that the more we struggle with our difficult thoughts and difficult feelings, the more we actually suffer. And so the task going forward is learning how to make space and room for our difficult thoughts and difficult feelings, and accepting that these are part of being human. As human beings, we often want certainties and guarantees. And sadly, after a cancer diagnosis, what we're left with is lots of unknowns and lots of uncertainties. And our brain often tries to help us by trying to problem solve these uncertainties and these unknowns. However, it's impossible to problem solve for something that has not happened and may not happen, and often our brain can end up going round in circles. It is helpful for us to think about our thoughts and work out what is a current problem and what is a hypothetical worry. A hypothetical worry is a worry about something that has not happened and may not happen. They're often thoughts that start with what-if statements. Using something like a worry tree can help us to work out whether it's a current problem or a hypothetical worry. If it is a current problem, it can be helpful to create an action plan as to how to resolve this problem. For example, the thought, I forgot to pay my credit card bill, ask yourself, is this something I can do something about? The answer is yes. Ask yourself what you can do, so you could ring the credit card company to pay the bill. When might you do that? I can ring them tomorrow at 9 o'clock when the company opens. And how will I do this? I can use my phone and I can pay using my bank card. If it's a hypothetical worry, and as I said, they often start with what-if statements. For example, the thought, what if the treatment hasn't worked? Ask yourself, is this something I can do something about? No, this is beyond my control. Accepting and letting go of the worry and focusing your attention onto something different. This is a skill that takes practice, and it will take time for you to see the benefit. Learning to let go can be challenging. We need to see that our thoughts are not facts, they're products of our minds. And we need to learn how to notice and observe them, as if they were passing cars, rather than get hooked into them and carried along with them. Focusing your attention on what you can control and what you can influence, such as making positive lifestyle changes, like improving your diet, reducing your alcohol, stopping smoking, and increasing your physical activity can all help. Also focusing on how you can reclaim your life back. Often people talk about a cancer diagnosis and treatment feeling like they've been plucked from their normal life, and when treatment stops, it can feel hard to know how to move forward again. We often talk about the new normal, and for some people they have to adjust to the challenge of long-term or permanent changes as a consequence of the cancer treatment or the cancer itself. However, that's not to say that everything has to be different, and sometimes focusing on small goals, such as starting a walk, building your confidence of going to the shop again, or doing the school run, can all help feel that you're getting your life back on track. Worry about the cancer returning is the most common concern for patients and their families, and it's important we get the balance right. If the balance tips and you find yourself worrying about this most days, and that these thoughts are particularly upsetting and they stop you from getting on with your day-to-day tasks, then please share these fears with your specialist nurse or your oncologist, as they will be able to signpost you to further help. Thank you for listening.